My name is Daniel Sullivan, and I am one of the founders of the Quantitative Imaging Biomarkers Alliance. This is a brief introduction to the genesis of QIBA. Clinical images are predominantly interpreted subjectively by an observer looking at the image. That is, the radiologist first describes what he or she sees and then what he or she thinks are the clinical implications. This process is inherently subjective or qualitative and results in enormous inter- and intra-observer variability. But until recently, little could be done to reduce this lack of reproducibility. However, in the 1990s on, dramatic advances in computer science and technology facilitated the development of computer-based imaging systems, which make it feasible to extract objective measurements from images and make radiology more of an objective science. Coincidentally, in the 1990s, cancer therapy improved, and it became less practical to use patient mortality as an endpoint in cancer clinical trials because many patients survived to go on to subsequent therapies. Therefore, the concept of progression-free survival became a preferred endpoint. And the main determinant of PFS in the 1990s was imaging, either CT or MRI. As this shift from mortality to imaging interpretations was occurring, FDA staff were very concerned about the variability in subjective radiologist interpretations of tumor progression or lack of progression. They made their concerns known to the pharmaceutical industry. The pharmaceutical industry, in turn, asked us in the NCI Cancer Imaging Program if the radiology professional organizations could do anything to help with this problem, since radiologists in clinical trials tended to use the same criteria they used in clinical practice. We in the NCI took this concern to the RSNA Board of Directors in 2005, and the board agreed that this was a legitimate concern for the practice of radiology. Thus, the RSNA board voted to devote considerable resources to support the incorporation of objective, quantitative measurements into the practice of radiology. In 2007, this commitment by the RSNA board resulted in the formation of the Quantitative Imaging Biomarkers Alliance.